Who would have thought that a brief impulse of electricity through a person's brain could help with some illnesses such as severe depression, but not have very serious side effects? I'm sure there are many of you who have known someone who's been depressed, or maybe you've been depressed before yourself. This procedure is mostly used for severe depression in today's society. This procedure has always piqued my interest, so I have done a lot of research to learn more about how and why it's done and the history behind it. There is much controversy about electroconvulsive therapy, but for someone to best understand what it is and realize some good in the use, they need to know the details of the history, the use of it in today's society, and the effects of receiving this treatment. This procedure is not very well known, but it has been around since the early 20th century and has much history behind it. In Andy Bierman's article on the Electroboy website, electroconvulsive therapy was discovered by Ugo Cerletti after watching a procedure of pigs being slaughtered after being shocked unconscious. He believed that this idea could be useful in the treatment of human beings. From the depiction of the movie One Flew Over the Cuckoo's Nest, people have started to believe that people receive these treatments for unnecessary reasons and that it is unconsensual. In the movie, the patients receiving the treatments were shackled to a gurney, and because of the medical field not being as well known as it is now, they did not receive any anesthetics or muscle relaxers to prevent injuries, since the procedure produces a brief seizure. The movie played a large role in discrediting this procedure. Even though it has been around for so many years, it still isn't well known in today's society. According to an article on mayoclinic.org, this treatment is much safer today than it was and is administered quite differently. In the article, A Brief History of Electroshock Therapy on Electroboy, it is said that the patient is given an anesthetic and muscle relaxer so there are no injuries or problems during the procedure. Compared to the history, the changes to this procedure now has made injuries less likely and much safer. This procedure generally takes no more than 10 minutes, and the patient never knows they had a seizure. Like many medications and procedures that are used to treat illnesses today, there are some side effects of using this treatment. In an issue of Health Media Ventures, Tammy Worth explained that one fact about electroconvulsive therapy is that it causes seizures during it, and there's memory loss from the treatments. She said that this treatment also may change the levels of norepinephrine, dopamine, and serotonin in someone's brain, which each of these play a role in depression. According to Julie Hirsch, who received these treatments personally, she said she greatly benefited from receiving this treatment. She said that after receiving this treatment, she was able to raise her kids and return to being a volunteer because her depression had improved greatly. She explained that she had memory loss 2 weeks before and after receiving her last treatment, but it came back after a while. Now that you know about the history, use in today's society, and the effects of receiving this treatment, I hope that you now have a better understanding and made an opinion based on facts. There have been numerous people that have been able to go back to living their normal lives just by receiving this treatment. But there are still people who look down on it. Don't let the history of this therapy make your opinion.